I get a lot of questions about the concerns of medication and the safety of medicine. Every medication potentially has a side effect, and those risks can be minimized by going to somebody who understands the treatment and can carefully monitor and has the time to monitor those things. In South Africa, we have two classes of medication. There is the stimulants and there are the non-stimulants. Amongst the stimulant medications, which are the ones that for most children and adults are the most effective, there are different types. There are short-acting, there are long-acting medicines. There are medicines that are intermediate-acting, long-acting, and then short-acting. There are generics. I often get asked, are generics effective? Generic is, in a way, a non-identical twin with a different name. There are also clones of medicine. That can be confusing. A clone is equivalent to an identical twin with a different name, often made by the same company. A generic medication can have up to a 20% difference in the amount included in that preparation and still be considered equivalent. An analogy could be if you go and order a cappuccino in a restaurant. If they had to come back, if you'd ordered a full cappuccino and they had given you 80% or even 3/4 and charged you the same amount, that equivalent analogy could be a generic. Some generics are excellent. There are generics that are made by some really good companies. So generics might not work for everyone. There is a price differential, and the difference in price has to be taken into consideration. Then there are the non-stimulants. The non-stimulants for the treatment of ADHD are not always effective, particularly in young children. They tend to be more effective in particular situations when the first-line medicines are not as effective. Some medicines work for some children, not the other. That decision has to be made by a very experienced doctor who understands the treatment of ADHD. It's very difficult to predict whether one medicine will work better for a child than the other. It's not related to the dose of the medicine and the size of the person, how big they are, how busy they are. Not necessarily if a child's hyperactive, they need a higher dose or a particular type of medication, or if they're more chilled and relaxed and smaller, they need a smaller dose. There are some children that need a small, almost a kind of a whiff of the medicine, and there are some children that need a huge amount more because of the way they clear and metabolize the medicine. So types of medication has a huge cost implication, and it's important to think about what type of medicine is right for a particular child. It has to be tailored to that particular person. So medication is only one of the options we have as doctors to treat ADHD. It must always be looked at as a holistic approach. Exercise is very important. It's almost kind of as effective for some children as medication. It helps release the dopamine in the brain and can minimize the amount of medication that's needed. A child who sleeps well is more rested and can have a far different impact the next day on the functioning. So medication needs to be used in combination with a child who sleeps well, who's fresh, who can have the maximum cognitive ability during the day. Exercise, as I've mentioned, and diet. Diet does not on its own manage ADHD, but it can be an important part of the fine-tuning of the focus and the overall health of the child. I hope that helps.